Hi, my name is Morgan and welcome to my channel. I'm currently halfway through working on my master's in clinical mental health counseling at Capella, and I decided to just make some quick low quality videos about things I wish I knew at the beginning of every semester. So today's video is about mental health counseling interventions. At Capella, the course code is COUN5830. This is required for the first residency trip. So stuff is about to get a lot more practical, a lot more real, and you'll see that in this course. So the textbook I actually liked more than any other textbook so far. It's written by Dr. Rita Summers Flanagan and Dr. John Summers Flanagan. They also have a lot of videos on YouTube of just role-playing counseling sessions that are very similar to what we see in the textbook, but I found those demonstrations really, really helpful. I actually found their demonstrations more helpful than the actual text. So I would really encourage you to go watch those. For the papers, we have to choose a hypothetical client, and then actually 2 of the course assignments will be about the same client. I would honestly recommend choosing your therapy modality first, and then choose a client based on that. I personally chose a culturally sensitive REBT approach. If you choose a behavioral theory, you'll probably have to find a lot of scholarly sources like that back up how you're applying that to a multicultural situation, just to show that you're being culturally sensitive and you're not just forgetting that part of the client's identity. But that should be pretty easy, but yeah, you'll have to cite a lot of sources for why you're making certain decisions if you choose a behavioral theory. For me, what really helped round out my papers was tying things back to what we learned in the intro class, strengths-based stuff, referencing the wellness model, referencing just like holistic type of stuff, and the continuity of care. That was really important for my client specifically. SMART goals, you definitely want all of your goals to be very measurable, very specific, and based on the symptoms that they're reporting, as well as incorporating behavioral changes in the client's life, not just dealing with the emotional symptoms. I would say a big recommendation that I put, this might sound kind of cheesy, but this is really important, is that it's totally okay to struggle with imposter syndrome during this class and to feel nervous about residency. Our self-reflection paper, again, this only applies to Capella people, but week 10, I think you have to write a self-reflection, and you can humbly explain what you don't know in a very articulate way that shows what you do know. Hopefully that makes sense. But I would just reference stuff out the wazoo, reference things you explored in other classes, things like that. Kind of ride that line between saying, hey, I'm competent in this area, and then also realizing that you're not completely competent. Don't pick an extreme, just honestly just like back up where you're at with sources, and it's okay as long as you know what you don't know. You're okay. In that final reflection paper, one thing that gets a lot of people is you do have to reflect on how you've been involved in a professional counseling association. My state, it's free for students to join the professional counseling organization, and many of the states it's free. I've seen some where it's like $25, $50, $75. I would honestly recommend at the beginning of the semester, signing up for a newsletter from them, like their email newsletter, whatever. And then as these activist issues come up, they'll give you steps to take action. Sometimes for these counseling organizations, it's like its own tab, that they'll give you a step. They'll give you like the numbers to call for state representatives or email addresses to write. I would say I would really recommend at least once during the semester, find one of those issues and then email them, or at least try to call them, because then you have something to write about in your week 10 paper as you self-reflect. you do have to talk about your involvement. So it's easy to just have some easy involvement that way, especially if you can't attend any of the meetings, like grad students are busy, it happens. So I would recommend that, or at least attending one meeting and taking some sort of action step about something that is remotely related to the specialty that you're pursuing. That'll really help you out week 10. So I really hope you all found this helpful. If you have any questions, leave a comment below. I'm going to link a bunch of really helpful resources that helped me drive home these course concepts in the description, talking about the C-SSRS, suicide assessments, documentation, SOAP notes, all sorts of stuff like that. I know there's a lot on YouTube, but some videos I found more helpful than others. So I really hope you guys find this list helpful. Thanks for watching, and best of luck in your program.